What if 1 in 4 people in the United States were infected with HIV? How would our lives be different? The transmission rate of AIDS, or acquired immune deficiency syndrome, is vastly higher in Africa than anywhere else in the world. This disease makes the body's immune system hard to fight off infections, and eventually the ability to fight off infections is lost. In this presentation, I will discuss the main reasons why the transmission of AIDS in Africa is so high. AIDS is so prominent in Africa as a result of the inability to seek acceptable medical attention, the lack of monetary funds of citizens and healthcare systems, inaction of African leaders, and promiscuous lifestyles. According to AVERT, which is the Global Information Data System for HIV and AIDS, in East and Southern Africa alone, around 19.4 million people are living with HIV. In 2016, there were 790,000 new HIV infections, which is 43% of the global total. Therefore, Africa accounts for around half of all HIV and AIDS infections in the world. This picture on the slide shows how many people are infected in different areas of Africa. In a documentary I watched by TV Choice Films, a 16-year-old girl in Swaziland was interviewed. She's the oldest member of the family that hadn't already died of HIV. That being said, she has multiple younger siblings she must care for, so she doesn't have enough money to seek healthcare services for herself. This documentary explores Swaziland and how bad the infection rate is there. I'll show you a clip from it.
There are 7 members of the family left. 7 more are at the bottom of the garden.
There's my father. Here's my mother. There's my sister. And there are my brother's 2 children. I'm afraid of dying, but if it can't be helped, then that's it.
They've given their best to try and fight it, especially for this family. They've seen their parents dying, their siblings dying, even their siblings' children dying, and they feel like they can't help it. They feel like death is conquering them more than they are conquering it, so that they feel like powerless.
The country of Botswana has the highest rate of HIV infections anywhere in the world. Roughly 43% of all people who live there are infected with the disease. In the second largest city in Botswana, around half of all pregnant women in the main hospital test positive for HIV. Hospitals in Africa can't afford the drug nevirapine to women during pregnancy. This drug drastically reduces the risk of transmission of HIV from mother to baby during labor, and that drug is used in the United States very commonly. This correlates to the issue of healthcare systems in Africa not having the financial stability that other hospitals in the world do. Not to mention, another significant contribution to the boom in HIV and AIDS in Africa is the use of non-sterile injections. Exposure to infected blood and blood products infected from the disease is almost impossible not to transmit if you come in contact with it. Contaminated hospital equipment accounts for around 48% of HIV infections in African adults. As you can tell by the picture on the slide, child mortality in Botswana and the possibility of death in the first 24 months is 38%. Subjects more likely to contract HIV are homosexual men have a significantly higher HIV prevalence rate. Citizens who practice promiscuous behavior such as prostitution is extremely common in Africa. Studies show that around 50% of all prostitutes in Africa are infected with HIV and AIDS. Some women are Since women are oppressed in most African countries, the only job some women can have is prostitution. This exposes these women to HIV and AIDS more frequently than the rest of the population because of the high numbers of sexual partners they have. Most prostitutes do not use condoms because they either get paid more by their clients for unprotected sex or they have no access to them in rural communities. It has also been shown by some studies that police harass women that are found with condoms. Their culture also has a desire for polygamy and having many children. That shows that they would be having unprotected sex with many of these romantic partners to have children. Inaction taken by African leaders has also not helped the situation. The president of South Africa from 1999 to 2008 denied that HIV caused AIDS for many years. His health prime minister said that AIDS should be treated with beetroot and garlic. African culture looks to natural remedies to cure diseases instead of seeking correct medical attention. The issue of poor education among African leaders and its citizens has increased the tolerance of the disease and will only continue to become worse. As research shows, there is a set of reasons that contribute to the high rates of transmission in HIV and AIDS in Africa, including low healthcare resources, financial statuses as a country and individually, and promiscuous behavior. This poses a huge health concern for individuals residing in Africa and a terrible life for those infected with nothing to do about the sickness. Suffering from HIV and AIDS in Africa is extremely common among its citizens and should not be tolerated by the rest of the world. AIDS is becoming tolerated in African countries and if nothing can be done about it. There are far too many deaths executed by this horrible disease, and something must be done to alleviate the problem.